Good morning, everybody. We have got just about it is 10 o'clock right now. Let's give it just a couple more minutes so that we can get folks in from the waiting room. As you come on in, if you would, please, in the chat, put your name and organization so that we've got a record of who's attending today. Thank you very much. And I am Avery Sliker with the Homeless Leadership Alliance, the Director of Quality and Performance Improvement. Thank you for joining us today.
Oh yeah, especially when he's on the phone in the office. Like, it just seems like she.
Unfortunate that I do feel that there could have been better ways in which leadership could have,
Good morning. As you come on, if you could please mute yourselves and put your name and organization into the chat. It is 10:02 and we've got around 65 participants with us this morning. So I want to go ahead and get us started and thank you all for joining us today. Again, my name is Avery Sliker and I'm with the Homeless Leadership Alliance of Pinellas, and I'm the Director of Quality and Performance Improvement. And I'm so happy that you're joining us today for our Family Flow and the System Navigation for Families in Crisis for this CoC informational meeting on April Fool's Day. If you are new and just coming into the meeting, if you would please go ahead and put your name and organization into the chat. This gives us a great tracking of who's attending today. We have a wonderful presentation for you this morning.
Can't hear you, Avery.
Avery, you're muted.
There we go. Is that better?
Yes.
Okay, so
Yeah.
Welcome everyone. Very quickly, if you're new and just popping in, go ahead and put your name and organization into the chat so we have a record. We have a full house this morning with currently 73 participants joining us. We're going to be looking at our Family Flow System Navigation for Families in Crisis for our CoC informational meeting on this April Fool's Day. Staff will be monitoring chat this morning, so please go ahead and put any of your questions in there. Hopefully we'll have time for question and answer at the end, but we'll try to respond to your questions within the chat as we get there. And without further ado, we're going to go ahead and we're going to get started. So Brianna is monitoring the PowerPoint for us this morning. So we can go ahead, Brianna. So what we know that the highest number of people experiencing homelessness in the CoC are individuals. We currently have 1,336 individuals on the CoC's by name wait list for housing. Per the housing inventory count for HUD in 2021, during the pandemic, there were 684 beds for individuals. That count does not include units that were specifically set aside for veterans or non-congregate shelter. That's purely for individuals experiencing crisis. So why are we talking about Family Flow then? Because the CoC faced a major crisis, and we are still within this crisis. The capacity to house families with minor children through emergency shelter was insufficient, and we cannot handle the inflow. There were only 142 units when we began this. So what we did as a solution was open non-congregate shelter, hotel motels. And these were funded reflecting that we had additional barriers then for families seeking shelter. So the family flow was created and implemented as a pilot project to learn how to collectively map this homeless prevention crisis system, maintaining flexibility as that system changes. As of this morning, there were 68 families on that shelter wait list, 64 families waiting to be referred for housing, and 111 families have been referred for housing. So why I opened with the individuals was because this family flow was created not only in response to that crisis, but also as a pilot project to take what we learned from the family flow process and then apply it to veterans and individuals in hopes to minimizing gaps to housing for all within the CoC. Okay, Brianna. Why create the flow? Because families were calling 3 different shelters, multiple community partners, funders, 211, the HLA, all to find out where was their availability to sleep. Coordinated entry assessments were not being completed until a family entered shelter. What that means is that those families were not being connected to housing opportunities, sometimes for months at a time. So now what we've done is we've created that single door access, and we've expanded the role of the coordinated entry navigator to ensure that even if a family is still sleeping in their car, which we hate, but we know it's happening, they are being placed on the coordinated entry prioritization list so that we can connect them to housing opportunities as those arise. Okay, Brianna. What is that family flow then? It is a multicolored chart. It can cross our eyes sometimes and give us a headache, but you know what? It serves a fantastic purpose. And it is showing that there is a fluid process. And we update this as the system is updated. As the system changes, as the target population need changes, we're updating the system. And this flexibility is allowing us to immediately address and then try to anticipate barriers. The shelter assessment is simple. It's looking at household composition, length of time homelessness, disabilities, and medical complexities. Olivia is going to go through that more in depth for you this morning. Brianna? And who designed the flow? You did. A majority of the people sitting on this call this morning and sharing their morning with us created this flow. HLA staff prepared and designed and documented some screening questions and the eligibility, but the continuum of care created this flow. Dozens of meetings with all types of stakeholders, and then we fully implemented in January 18th, 2021. So with that, I'm going to turn it over to Olivia, let her introduce herself, and then take you through where we are right now.
Good morning, everyone. My name is Olivia. I'm the Community Navigation Manager here at HLA, and I am going to start with the beginning of the flow. And our front door is 211, so 211 will screen the families for the Family Services Initiative, as well as other vital services in the community. Today, that process is changing a bit with the Family Services Initiative, but I'll go over that briefly in the next slide. If the families are not eligible for FSI services, then 211 will initiate the process of asking them where they slept last night. And if they slept on the street, in a car, or in a motel paid for by someone else, they will first be screened by family work. If they slept in their own home, they'll be screened for eviction prevention. Next slide, please, Brianna. And as of today, FSI now has their own call center. It is being managed by PEMS, and it is called FSI Connect. I'm sure many of you have seen the flyer. And the criteria that they're looking at for the families is that they must be below 250% of the federal poverty line level. They must be able to prove their sustainability within 60 days, and they must have a qualifying event. The qualifying event can be a gap in employment, medical issues, childcare issues, transportation. If they're finishing school, they're really open to different qualifying events to ensure that they're able to serve the family. And I know I probably don't have to mention this, but there does have to be a minor in the household, or someone in the household has to be pregnant. Next, thank you, Brianna. And eviction prevention is another service offered throughout the continuum of care, and that is when a housing situation is directly related to COVID. And a few of our nonprofit legal service providers in the community, including Community Law, Bay Area Legal Services, and Gulf Coast Legal Services, work to help either keep the family in the home or connect them to vital services to ensure that they are not on the streets. If FSI and eviction prevention aren't a good fit, the family will then be screened for Family Works. Family Works is a Directions for Living program, and they work with families in the following schools. They are there to support the family and help them through their crisis. And as a continuum of care, our goal is to screen in. So this family flow often goes through changes, and that's perfectly fine because our goal is to be able to serve the families within Pinellas County. And first, they will be asked if they will have proof of income, ability to pay all of their expenses, and a qualifying event. If they say yes, and their income is at or below 250% of the federal poverty guidelines, they will be referred to FSI. If they say no, the question will be asked as to where they have slept last night. If they slept in their own housing or a self-paying motel, and their housing situation is a direct impact of COVID-19, they will then be asked if they're facing eviction. If they say no, they will be screened to see if they're in a transformation zone school, and they will be referred to Directions for Living Family Works. If they are facing eviction, they will be referred to legal aid, which we briefly went over in a previous slide.
Thanks, Olivia. Good morning, everyone. My name's Carly, and I see Teresa has her hand up. So, Teresa.
I just wanted to clarify that if those transformational schools are only in St. Petersburg, because I think that's important to point out. I don't believe the Family Works program is affects all transformational schools, which may be outside St. Pete. Correct?
Thank you, Teresa. Yes, that's correct. We do have on the flow the list of the transformational schools and the Family Works schools. So when we provide our supplemental materials, we can update that as well. So everybody has that comprehensive list. I know I look back at it all the time. Helen?
I just wanted to ask a clarifying question. If you could go back to the previous slide. I've seen the flow chart so many times, but I guess this is the first time that I've heard it this way, that if the family doesn't meet a certain criteria, then if your housing situation direct impact to COVID, if the answer is no, does your child attend a transformation school? Does it matter if it is a direct impact to COVID or any of those things if they're in a transformation school is my question.
It really does depend on the funding source. And, you know, the family flow, it does a good job of just giving the basics, but there are always other programs that we can link the family to make sure that they're supported. For all intents and purposes, right now we are just focusing on the transformation zone school, but we will go over more programs and more directions that the family could be pushed to momentarily. Thank you for that, though. Thank you for asking that question.
Another thing was mentioned that in one of the slides, it says that it's 250% of the federal poverty, but then the next slide said 200. So we received the FSI Connects flyer yesterday where we saw the updated amount. And so the correct amount is 250, right, Olivia? It's just that the chart on the previous slide said 200. So that's just an error we can fix, but because that's what the flow looked like originally. But with this update, Olivia said it right the first time. So I want to make sure everybody's clear on that. Does anyone have any more questions about that before I keep going? No? Okay. Again, my name is Carly. I'm the coordinated entry manager here at the HLA. So we're going to be moving more down in the flow. Like Olivia said, we started with our FSI and Family Works. And what happens when that's not a good fit, or for eviction prevention. So 2-in-1 will determine if the family is literally homeless, which means that their nighttime residence is not meant for human habitation. So someone who lives in a shed or in a car, in an RV, on the street. And the reason that we do that, right, is because there's different resources for where it is that you slept last night. So before we move on, I want to say that there's a good metaphor for understanding the crisis system for families if you're thinking about the system as a house. Different parts of the outside and inside of the house are going to be different stages of the system. So our system is aiming to keep people from having to enter the house, and I'll explain this metaphor as we move through, but I just wanted to note that before we kept going. So Brianna, you can go to the next slide. All right, so what happens if the family is literally homeless? So the first question we always want to know is the family currently fleeing DV? And this is going to be imminently fleeing. So if the answer is yes, we're definitely going to refer the client to the DV hotlines for CASA and the Haven. There are two separate numbers which we can provide for you guys when we send out the materials for the screening. And it's pretty much the same for both hotline. When you call on the hotline, they're going to screen you and they're going to do a lethality assessment first. Once they do the lethality assessment with you, they're going to start asking some other questions to get more information about your family composition. And they're going to see if there's any other immediate resources the family could use right now. They're going to check to see if they have their shelter availability. Maybe they're going to come up with a crisis plan for you, just in case, you know, what happens if you need to leave right now, if you're still in the home. And if there's no space, they can help try and connect you to other shelters, whether it's in this county or another county. They can also refer you to the Florida DV hotline, so you can work with them on a placement outside of the county if that's an option for your family at that point. So there are two different numbers for each DV shelter. And like I said, they're going to do a lethality assessment and go through with the family the options. They can also connect the family to their other resources, like as if they could use rapid rehousing or outreach services or support groups. They can connect the family to those resources as well. But of course, if there is no space in any of the DV shelters and the family feels comfortable entering a regular shelter, they can come back into our system. We'll make sure that their privacy is at the utmost importance and work with them in the regular flow. So if the answer is no off the bat, the first thing we're going to ask is there somewhere that you can go with provided financial assistance? And so this is going to be a referral to HLA Diversion if yes. So if we're thinking about this in the house, our sidewalk would be the prevention. You're walking up and we're still preventing you from coming to our porch. Our porch is going to be our diversion, right? So we haven't let them in the house yet, into the system, because we want to make sure that there's no other safe option for the family in the meantime. So if they need a traveler's aid, so they can go to another state or county to live with family or friends, or if there's someone here that maybe that we could help pay a utility bill for a month so that the way they can stay with a friend or family that time. And so of course, that's not always going to be an option for every family. So if the answer is no, 211 is then going to conduct the family shelter assessment and add them to our shelter prioritization list in order of score. So this is when they're entering now the house. They've gone to the foyer. So we can go to the next slide. Okay, so, right, of course, if they're not literally homeless, backing up to the top now, we're asking, when are you going to be literally homeless? If they're going to be homeless within 72 hours, we consider that our diversion intervention. So who can you go with? Where can you go? What do you need to go there? What kind of assistance do you need to get to the location that you're trying to go? If this is unsuccessful, we can conduct the family shelter assessment and add to the shelter prioritization list. And when they're doing that with a diversion, you know, that's a conversation they're having with a client, right? I heard an example one time where we're asking, okay, if someone else was in trouble, who would come to you, right? Because usually that kind of relationship is reciprocal in that sense. So we're having a conversation and trying to figure out what other option there is. If they're going to be homeless within 72 hours or more, we consider that our prevention intervention. And then of course, if they're unsuccessful, we go back to diversion, and then we would move down through the flow again back into to conduct the shelter assessment. Brianna, you can go to the next one. Thank you. Okay, so I know I said a lot about our family shelter assessment at this point, and kind of to explain what that is. So when a family is determined to be literally homeless and in need of shelter, we're conducting a short assessment with the family, 211 is. And they're asking them a couple questions. And so these are some of the criteria that's on this. We ask for the length of time homelessness. The longer that you're homeless, the more points you're going to score. So the assessment's going to eventually produce a score in the end that shows how vulnerable the family is. And then we would move down into household composition. So we're getting the ages of the family members in the household. If someone's older than 62, they get a point. If they're an unaccompanied youth, they get a point. If they're pregnant, they get a point. And then you would get more points if your child's under 1, you know, and then if your child's 1 through 5. So we're collecting that data for the vulnerability aspect of that. And you can go to the next slide. Okay, so the next is about disabilities and medical complexities. So there's a couple questions on there. So first we're asking if the parents either have an underlying condition, medical complexity, or someone with a disability, and then we're going to move to the children afterwards. We're making sure that if someone has a medical need for electricity, they're prioritized, or some more than one person in the household with a disability or underlying condition. And then we have our tiebreakers, and this is how long somebody was a Pinellas resident for. So right now, this is currently how our assessment is working. So the maximum possible score you can get is a 26, and then they would be generated onto a list in order of score. We are working constantly to improve our shelter assessment. It's not always going to be the case that assessment can capture the true vulnerabilities of every family, because everyone's history is so complex. It doesn't capture aspects maybe like trauma or recidivism into the system. And so at this point, we're trying to always improve that and, you know, take feedback from the community to see what it is that we missed about a certain family that would have placed them higher on the list. Oh yeah, and then so families, so that it's not always possible to refer exactly from top to bottom onto to shelters from the shelter list because of what a shelter can take. So there's eligibility requirements. If a family has 4 people that they can take and the first family is a 7, right, that's not going to fit. So we would move to the next person down on the list. Okay, you can go to the next slide. All right, so what happens after the assessment? So after the assessment is conducted, they're added to the shelter prioritization list. And then 211 or diversion will schedule a time for the family to complete the VI SPDAT with the Hla navigation. So as Avery said in the beginning of the meeting, the only way that families could get a VI SPDAT originally was by entering shelter. But we all know now that that's not possible if there is no shelter space and there's a large wait for that availability. So now we've made it easier so people can access the possibility of rapid rehousing or permanent supportive housing before actually entering a shelter. So they can start moving through that process without the barrier of needing to get into shelter. So 2 and 1 in diversion, when they're unsuccessful, right, they're scheduling, they're doing the shelter list, and then they're going to be scheduling for the VI SPAT with the HLA navigators. I don't know if I'm past. Okay, I'm still good. Okay. So for the HLA navigators, we're assisting families by linking and referring them to other resources while they're waiting for shelter, of course, right? If a family is having trouble with childcare, we're going to make an ELC referral. If we know the family could use disability but hasn't yet applied, we're referring to SOAR. If there's a mental health need, we might go to PEMS or another agency. So we're always just making sure that every avenue has been exhausted for the family while they're waiting for shelter. Our navigators are also helping clients get document ready. So we're collecting verification of income, birth certificates, helping schedule appointments for Social Security. So this way, when they're finally referred to that housing intervention, they are ready to go and enter the program. And so then, of course, you can see on here too, there's another part for this case conferencing. And so that's going to be our next slide. And then for case conferencing, so every week right now, we do case conference at least 2 families that are currently waiting on the shelter list. And we do this because we know that these families are homeless. We know that they're in crisis. We have a list, we see their names, and we owe it to these families to do our part to make sure that we're making sure that they have everything that they need and there's not something we missed for the family in the meantime. So like I said, 2 families, usually one that's higher on the list and one that's lower on the list. And we're ensuring holistic and coordinated assistance across providers. And we're trying to identify and track systemic barriers and strategize solutions for the families. Does anyone have any questions? I know I said a lot, and I don't want to let anyone forget if they had one. No? Okay. Oh, Lizette.
Hi, good morning. I'm a little confused on where does HLA enter?
Okay, so HLA would enter, so when they call 211 and they're confirmed to be literally homeless, so there's 2 ways they would enter. They would do that shelter prioritization list, and then they would schedule with HLA so they could get into coordinated entry. This is where they would get their coordinated entry assessment, which is what we use as the VI SPAT. If they call 211 and they have a divertible option or they need prevention, then they're referred to our diversion or prevention team. So they can come in both ways. But it usually always ends, if the family stays literally homeless and ends up needing shelter, with our HLA navigation team. Does that make sense?
Yeah, and then so then with that, when they're connected to HLA, they would go through the process of being like working with like housing specialists. Is that?
No, so our team, the HLA navigators, they don't do that part of it. So they're just doing the document ready part. They're case managers while they're waiting for shelter placement with rapid rehousing. Once they would get into rapid rehousing from the coordinated entry list, it's a warm handoff between our team and the rapid rehousing provider, and then that's where they're assigned that housing specialist at that point.
Okay, so is this only for families, or do single adults also get access to HLA as well?
So this flow specifically is only for families. It's a pilot. So this way, if it does end up working out, when we're settled, we can start using it for individuals. But our navigation team can get individuals document ready, but they're not conducting the VI SPATs on individuals. So individuals would still need to enter shelter to get the assessment.
Gotcha. Okay. Thank you.
You're very welcome. When we send you guys our final flow with the map, it's color coordinated with the agencies on it. So that visual might give everybody like a better understanding. I know it's hard when I'm jumping from all different sides of the flow. So those were good questions. Does anyone else have any questions? No, if you think of anything, we'll have time at the end too. So, all right, I'll pass it on.
So it looks like this is me. And I am April White. I am with the Homeless Leadership Alliance, and I am a community navigator. And I'm just going to give a little bit of a story, kind of just to give you an example of that flow that Carly and Olivia just went over. And so this is a case of, we had a 18-month-old who had an infant child. She originally became homeless due to her own mother becoming homeless as well. And she went through, as we stated before, she called 211. She got set for a Calendly appointment on my Calendly, and I was able to contact her and initiate intervention. She shared that she had been sleeping in her car. She came from her auntie's home, but her auntie did put her out. And so she was just trying to get services. I helped her with doing her SPDAT. 211 did put her on that shelter list, but she didn't really have any disabilities. She didn't really have any, she was having a little bit of income, but she wasn't really too up high on the list. But we know with her age and having a young child, those are both two young individuals. Even at 18, we understand that you're not really an adult and life can really get hard. So one of the things that we did was we case conferenced this family. Originally, she was nervous to go into shelter. And we found out that that was due to some of the trauma that she went through. And with community partners kind of rallying around her, we were able to figure that out of, okay, what would be the best option for this family? Maybe shelter isn't the best option because of what she went through. What else do we have? What else do we need? We tried diversion again with that auntie where she was. It was unsuccessful, unfortunately. She went back there. We tried to say we would pay through diversion, and the relative did put her out within 24 hours. But we were able to come together again, and she was able to get rapid rehousing with her age and the infant of child. And she was also able to get hotel payment to be able to have her be stable until she can really get that support. I also worked with her on getting her ELC, so she was able to get daycare and work full time instead of having to work part-time, or instead of having to ask those family members that she's having a hard time with to watch the child, and she go through that again. So we were able to do that. We were also able to get her document ready very quickly. I want to also say it wasn't just us. This client was very much advocating for herself as well, and very much open to trying to figure things out with the whole community. Directions for Living got involved. Like I said, Diversion got involved, 211 got involved, all of us got involved, St. Vincent de Paul, to really rally around this client and to show like basically what this flow really looks like. She actually just texted me yesterday and told me that she got her rapid rehousing, her Section 8, and she actually has found a place. And now she is looking for beds and things for her home. So now I'm going to be working with her on actually trying to contact that FSI team and say, hey, can we get beds for this family? And can we continue to rally until she really gets that success she needs? So that's what I got.
Thank you, April. That was a fantastic success story showing how
Sorry, I
all the
didn't realize
community comes together.
I didn't realize I was missing the PowerPoint. My bad, but that was all that I talked about.
Thank you. Hi, everyone. So this one will be me. I'm TV, a prevention diversion specialist at HLA. And now looking at April's story, I'm like, dang, I thought we had so many agencies on this one client and then you have everyone. But so this client was a single mother of 3 who was actually stably housed in Tampa for about 3 years before rent just kept increasing and they couldn't afford it anymore. And this happens a lot where the clients will say, we were just looking for cheap hotels, and they go back and forth between counties. So they found a cheap hotel in Pinellas County and obviously tried to stay there until all their money went out. And they were able to connect with street outreach from Directions for Living. So that's how they began to enter our system. I know in the beginning, the flow was going through 211 and all that. But so they connected with Directions for Living, who ended up providing them services in the form of a hotel stay. And I believe that was in July of 2021. So that's when they first connected with our system as a whole. And they were referred to HLA in October, so about 3 months later. And that's when we started exploring their diversion and prevention options, no longer prevention at this time since they were getting paid to stay in a hotel. So we're looking at where they can go if they have any friends, places like that. And after some conversation with the client, she said that she had an aunt in Ohio that would be able to take them in. And I don't know if they just recently connected because they had 3 months homeless, obviously, but I was able to speak with the aunt and she said, yeah, of course they can come up and stay with me. So we were looking at tickets because she didn't have any transportation and she had 3 children with her. And these tickets, I think we were looking at bus tickets, and it was about $710 for all 4 tickets, which is a hefty amount for anyone to pay. And I think at that time our funds were a little bit lower as well. So we connected with Daystar, who offered to split it with us, which is awesome. It's so nice to always be like, oh, can you help out a little bit? And then they're like, yeah, we have a little, we can help you. So we were looking at buying tickets, and the way that our funds are running and all that, we were supposed to each buy 2 separate tickets, but you can't buy minor tickets separate from adults. So you have to buy them all together. But our supervisors and everyone were able to connect with our funders to make sure it was okay that Daystar paid for everything and we just paid them back for half the amount, which I thought was awesome and obviously a really good way to get around any kind of barrier that we saw. So this was definitely a case where we had a lot of different agencies coming together to successfully divert a client. We were able to send the family together back to Ohio, and she's able to stay with her aunt until she can save up a little more and get back on her feet.
TV, thank you so much. Thank you, April. I think what you heard from our 2 success stories reaffirms what we show within the map, that this is a community process. This is a community flow. It was built by the community for the community, and that's who's working this flow, is the community. What are our next steps? Obviously, there's going to be a new map that's going to come out. So everyone will be getting that shortly. We need to make a few more tweaks to it. And again, it is an ongoing flexible process. So from just today alone, we may make some changes within that map based upon maybe some suggestions that come out here. It is an ongoing, continuous, constant review of all the processes, the assessment, the gaps, the barriers, and most importantly, the successes and lessons that we are learning. A great example of that is that earlier I said the assessment score went up to 20, and no, it doesn't. Now it's up to 26. So it changes. We're constantly changing and updating. I think, though, one of the most impressive things about this flow for me is how it is impacting and affecting our policies and procedures, especially those within coordinated entry. What we're finding is that it's no longer those of us sitting on administration creating policy. Policy is actually being developed now and reviewed and approved based on that true client need. What's the client? What are those families telling us that they need? And from you, the providers that are working and telling us, this doesn't work anymore. We need to change this system. We need to change that process. And we're hearing it. So that's why this is an ongoing evaluation. This is the pilot project, and we are going forward. The veteran mapping is in progress right now. So with that, I will open us up to any questions or answers. Questions and answers.
I will say I saw someone had a question about when a SPDAT is scheduled and their appointment. And I just want to say that the client gets to set the appointment when they call into 211. It is 3 community navigators. All 3 of us have each set days. And so they can choose between Monday through Friday which day and what time they would like to pick themselves. So if they want to do it that day and there's time on the schedule, they can, or if they want to wait 2 or 3 days or the next day, those appointments are always there for them, Monday through Friday.
Thank you, April. Does anyone else have any other questions or anything that possibly may have gotten missed in chat?
I see someone's hand up.
Hi, yes, I have a question. I'm hearing the intake through 211 is the best method, but I also see a link that was put in the chat to an HLA contact form. Can you guys talk about that a little bit?
Olivia?
Yes, of course, I would love to. So the contact form is actually a contact form for all of our programs. And the client or provider can go through the contact form, and then that way we can identify what services they would qualify for right up front. And then that form will be sent to the correct program, and then we will reach out and further assess. So either one of those methods is fine, but for category 1 clients, the route through 211 is definitely the best. They get quicker service because they get on the shelter list right at when they call, and then their Calendly appointment is set up, as April explained a few moments ago. So it definitely is the best for our families that are on the streets.
Hey, thank you so much for that clarification.
No problem.
Okay, April Hunt's got a great question that she's hearing that COVID-related funds that have been received for homeless-related services have been extended through September 2022. And is that correct? And are any funds excluded from the extension? April, what I can say is that the last that I heard from Amy, that it was still up in the air. And the last we spoke, and as unfortunately, Amy's out today, so she could have gotten an update last night that I'm not aware of. But the last that I heard, and I was just on a call today with the Florida Association for Ending Homelessness, and no one noted it yet. So it's still a pending approval as far as I know. And as soon as we know, we will let you, the community, know. Jay's asking a fantastic question. What if there is no shelter? And what if there is no COVID-related homeless issue? And Jay, thank you. That speaks to what April put in the chat very early on, that the continuum of care, our CoC, has been within this family crisis for some time. It didn't take COVID. We only have 142 beds for families with children. As Carly stated, that also depends upon what's empty at the time and what family size could fit into those empty units. And so, unfortunately, we're having families on the street. And our response to that has been our local communities stepping up, our local funders stepping up, and assisting through opening non-congregate shelter beds. For how long that will continue, we don't know. And April, you bring up an excellent question again of how many of those emergency shelter beds are at no cost to the provider or family. And I don't have that with me, but I can definitely find out. Lizette, is there access to hotel and motels when this occurs? Again, the access for non-congregate shelter, that is that hotel motel, or access through what could be a hotel motel voucher program, goes through the flow that we went through this morning. These are fantastic questions. Anything? What else? Anything else? Does a non-documented family have this service and access? So what we would do on that is, again, that's going to come down to funding source. And so we would work on that as an individual case. I know that for continuum of care funding, HUD does not require verification, but they do take different forms of identification and verification forms. So it would come down to what that funding source is, Andrea. And just for information, Jay is Jane, and Maria and Leon at Daystar. Welcome, Daystar.
All right, we see Kathleen has her hand up.
Hi, thank you. I was just wondering, Avery, thank you for this information. Can you go over, if I didn't catch the number, how many families are currently on the list, not in any kind of shelter, waiting for hotel rooms or whatever, and how long is their average wait?
As of this morning, we have 68 families on the shelter wait list. And for the time frame, I'm going to look to Carly for that, if we even have an average or an estimate.
I would say there's not an average estimate because we're not first come, first serve. That would definitely give us that information, but since that's not how we're operating, we don't actually know. It could be as little as 2 days for some people, and some people will never be referred. Unfortunately, that's just how long the list is. And I did want to mention this. I know that 68 families feels like a lot, but we have gotten up to around 85 at one point. So we do have people self-resolving. We do have people getting placed. So 68 to me was a positive number in the worst way. I was happy to see that it had gone down so much because people were becoming housed through rapid rehousing, or we were able to divert at one point. But Kathleen, that was a good question. Did you have any other questions? I didn't want to cut you off.
No, that's good. Thank you very much.
You're welcome.
Sharon is asking for non-speaking families and clients, especially non-Spanish speaking, how do they do the SPDAT and intake through 211? All of our partners should have a method internally in regards to how they handle accessibility. And so therefore they would need to utilize internally.
Oh, Mickey,
And I
okay,
believe
Mickey can
Mickey
answer
is
that.
on the line.
Yes, so this is Mickey Thompson with 201 Tampa Bay Cares. We utilize language line interpreter services. So we do have the ability for many languages, not just Spanish, to conference call somebody in and, you know, do a three-way conference call with those individuals. I do want to clarify that 211 will not be doing the SPDAT. We're not doing that on the line at 211. And so that question of how to do the SPDAT in Spanish, I would turn to the Homeless Leadership Alliance, because we would just be setting an appointment at 211 for that to happen.
And as Mickey said, we do have internal processes where we too use a language line if needed. We also could use Google Interpreter, even though that's not the best method. But also we try to use some local interpreters, such as the Hispanic Outreach Center. They are a member of the Continuum of Care, and so we would also reach out to utilize those. And the SPDAT does come in different languages. Spanish is one of those. Any other questions or hands? Well, I want to thank everybody for joining us this morning. I want to thank April TV for sharing your success stories with us and helping us see the outcome and get to know your households and your families a little bit better. For Olivia and Carly for sharing your great expertise with us. I want to thank Brianna, who's in the background and facilitating all of this. And I want to thank all of you. We have got 87 and we had 89 people on this presentation today. That is a phenomenal call out to a sense of community, not just within the continuum of care, but also the friends of the continuum of care. I want to thank every single partner on this call. You have been the push behind this flow, and you are the ones that are creating those success stories and the lessons learned. And with that, we do have Carly's information in the chat. We will make this presentation and recording available to everyone at a later date. And I just want to say thank you. Have a very happy Friday and a joyful April 1st.
Thank you, everyone.
Thank you as well.
Thank you. Thank you, everyone.